Healthy. So for those joining us today for the first time, Healthy House is a culturally tailored nutrition and lifestyle program targeted for people of African and Caribbean backgrounds. So each Tuesday, we come with very interesting topics from trained or qualified people talking about diet and healthy lifestyle. So for today, we have one of our very own, Sylvia Ofvobe, who she's a registered nutritionist. And today she's going to be discussing with us a very interesting topic. And I think for previous sessions, the topic of this came up, but we couldn't discuss it in depth. So we felt it would be good to be able to talk about it today. And today I'm stepping in for your regular host, Dr. Hibbah. So my name is Evans Asamane. I'm a public health nutritionist. So for those joining us from Facebook, YouTube, or even on this channel, kindly put up your questions on the chat, and after that we would attend to that. And I think Sylvia has a very interactive session for us, so it's not our traditional the talk and questions at the end. So let's stay tuned and enjoy this session. So we'll be looking at what are the importance of vitamins, what is the taking supplements. So what do you know? How much do you know about supplements, and do they work the way they are to work? So Sylvia will take us through the well of dietary supplements and what we can do to be able to keep a well healthy diet or healthy lifestyle. So over to you, Sylvia.
Thank you very much, Dr. Evans. Thank you. Hello, everyone. Good evening. So my name is Sylvia Ofvobe. I am, just like what Dr. Evans said, I am a registered nutritionist. I'm also a certified health coach, and currently I'm working as a dietetic assistant. So I'm going to just share my screen. Right. Okay. Can everyone see my screen?
Yes, we can see your screen.
Brilliant. So this topic, dietary supplements and all you need to know about dietary supplements. This is a very interesting topic for me because currently in my line of work, I deal with supplements. That's what I'm mainly focused on. I deal with patients who require nutritional supplements. So we call them oral nutritional supplements. And because of that, I think it has allowed individuals and people outside my line of work to kind of always reach out to me and say, oh, Sylvia, I want to buy a supplement, or I want to get a supplement. What do you think? Can you recommend something? What do you think will work for me? Which brand is the best brand, or what do you think I should get? And when I run through certain questions that I would usually have with my regular patients, they don't seem to have a suitable answer. It's always no, no, no. It's never, oh yes, I think that's why I need it. Oh yes, it's always no, I just want to. So I'm like, okay, it kind of looks like a lot of people don't understand the need of dietary supplement. Should you be having it? Should you not be having it? What's the background story? Why is it even there in the first place? What do we need it for? So that's why I said, okay, you know what? Let's have this. And obviously, I want this to be an interactive session. I don't just want to come and see everything. I want to know what you know. Have you thought of getting a dietary supplement before? Would you randomly walk into the shop and things like that to get a dietary supplement? So I want to have that interactive conversation today. So first, let's chit chat. Let's have a conversation. What do you think the term supplement is? Like, when you hear supplement, what comes to your mind? So I'm throwing this question to everyone. You can put your answers in the chat box. You can raise your hand. Just want to know, what do you think supplement is? Okay, yes, Kabirat.
Okay, thank you. Good evening. Well, I think supplement is what we think it is for a replacement of some nutrients we are not getting in food or we don't get it adequately. So we try to get something that is already refined and the nutrients are put in that thing so that we can get adequate nutrients of the particular vitamins or something we want. So looking for an alternative from food. That is what I think.
Okay. Thank you for that. Any other person wants to share what they think supplements coming?
We have two in the chat. Let me just read it out for you.
Because I don't
So
think
it says, not the main meal, but addition to health. And another one tends to help us meet our requirements.
Okay, yeah. So
another one, last one. Another one says additional minerals, vitamins, or sometimes we can't process the necessary minerals, vitamins. Yeah.
Okay. Thank you. Yeah. So I think everybody has kind of answered the first one and the second one sort of together. Well, yeah. So supplements kind of will mean like to boost anything you're adding on, either you're boosting, either it's an add-on. It might not necessarily mean that. It can be in general. So you can add a supplementary document. I sent a supplementary document and things like that. What I'd already said. That's like the term supplement kind of means adding on, sort of. Now, when we now say dietary supplements, so just like everyone had explained, and they're giving what they understand, in my own understanding, it has to do with adding something to your diet. So you have your diet and you're adding something to it. In other words, it's not like you are replacing the diet. It's not like you're going to stop that diet. You are just adding something to your already made diet, sort of. Now, another question that I would like to know, what do you think? Do you think supplements are drugs? If someone says, oh, would you classify supplements as a drug or as a medication, sort of? What do you think? You can pop your answers in the chat box, or you can turn on your mic. Has it ever crossed your mind that supplements are they drugs? Are they medications? You know how you take medications to treat certain things. So do you think you also take supplements to treat things? Like, would you consider them as drugs?
Someone is asking what's the difference between drug and medication.
Well, I think it's very evident now that we're in the UK, because you know how in Africa we will call medicine drugs and things like that. But in UK, when you say drugs, you actually are referring to like maybe cocaine or hard drugs and things like that. So for that sake, I will use the term medication. So sort of, yes. Okay, yes. So I will answer that. So no.
It's a bit from the chat.
Okay.
A few from the chat, yeah? Do you want me to read that for you?
Yes, please. Thank you.
Somebody says yes, and somebody says need to make sure you don't overdose, as you can have too much, even though your body will release in excess. And another person says, no, it's not a drug or a medication. Yeah.
Okay, yes. So no, actually, supplements are not medications. So medications are made to treat, prevent, or cure a said illness or something. But supplements do not treat, they do not cure, they do not prevent. So supplements are not in any way classified as a drug or a medication. That's one thing cleared. Now, we have different types of the supplements. When you go into the supermarket, how do you know which one exactly you are getting? So, I've got vitamins and minerals, which consists of the vitamin A, vitamin K, vitamin D, C, E, minerals such as magnesium and things like that. Then we've got the life microbials, which are like your probiotics. So you have probiotic supplements. You have amino acid supplements, which can either be the tryptophan or glutamine. You have herbal supplements such as ginger supplements or garlic supplements and things like that. There's a very popular one. I can't pronounce the name. I think it's Enchisia. Also, it's kind of like a herbal supplement. Then you have the botanical compound supplements. Those are kind of like caffeine supplements. So maybe people who feel they need to be pumped up and will not rather have coffee, but think they can have that caffeine supplement. Then fish oils such as the omega-3 fatty acids or the omega-6 fatty acids, and then collagen. Now, these supplements come in different forms. So it can either be in the liquid form, it can be tablets, it can be capsule, it can be soft gels, it can even be in powdered forms. There are different forms of supplements. Now, do you need this supplements? Like, one thing we need to know is with supplements, there's a varying factor. So just like I earlier said, I will ask people certain questions in order to know if do you actually need the supplement. And these are things that you need to put in your head before you wake up and decide to get a supplement. Do I need it? Now, first you need to consider your age. We're all not the same age. They're different age groups. You have an infant, you have a baby, you have children, you have teenagers, and you even have adults, and you have the older adults. So with age, supplements will differ. There's also the health deficiency. So when I'm saying deficiency, I kind of mean are you deficient of anything? Are you deficient of any of the vitamins and the minerals? So is it that you're having health issues, or do you have a particular disease and the doctors have told you, oh, your vitamin D level is low, your vitamin C level is low, you're not getting enough vitamin E, is there an underlying health condition? Is there a problem? Is there anything wrong with you that you feel you need to have a supplement? Or what is the issue? Do you think, my skin is not shining enough? If I take certain supplements, my skin will be glowing, or it will prevent wrinkles, or hair loss and things like that, or supplements for my nails. Is there any issue of that sort? So you also need to consider that. And then also what you eat. Now, we need to understand that most individuals get their required nutrients from the meal that they eat. So the nutrients that we need to function daily, the essential nutrients that we need to function daily, most, emphasis on the word most individuals get those nutrients from the meals they eat, while some individuals need to take supplements to add to those meals. Now, there are several reasons why that happens, and we'll come to that. So another thing you need to know while you're thinking, if should I or should I not get a supplement, it does not prevent or treat any disease. So why would you want to be taking something that it's not going to stop, or it's not going to revert you back to how you were before the issue started? So it doesn't prevent, it doesn't treat any disease. You're going to have to understand that. Also, supplements are not regulated by any law. So just like I said, it is not a drug. Supplements are regulated by the food law. It is termed under food. So because it is not regulated by any law, there's no tests that has been done. Medications, sorry, I'm going to start saying medications. Tests have been carried out while they're doing all the preparation and lab tests and things like that. Tests will be carried out to ensure that, this medication works, and this medication is safe for you. The drug companies will not just release medications out there without knowing if it works or if it's safe for you. But that does not apply to supplements. Those laws do not govern supplements. A company can wake up and create a supplement and tell you this supplement is good for your hair, is good for this. But no test was carried out to tell us if that supplement works or if it's even safe. Yes, initial tests will be carried out in the lab, but those small tests that are carried out in the lab is just to ensure that oh, the way they said they are going to make the supplement is how they made it. Oh, the ingredients that they've listed at the back of the supplement container that they say is inside, okay, it's actually inside. They actually did put it inside. Those are what those tests are for, not whether it works or whether it's safe. So at that point, you're blank. You're not even sure whether what you want to get is going to work for you or whether it's even safe for you. Now, this brings us back to science now. Okay, you said you did not do any tests. Let's now talk science. Is they actually, all these ingredients, they say you could say that if I eat ginger is good for me. But they put ginger inside now. What's the science behind it? Now, researchers have shown that there is no evidence whatsoever that proves that supplements actually provide like a significant benefit to you. There's no evidence on that. In fact,
that's an interesting one.
Yeah,
Say that again.
It's very interesting. There's absolutely no evidence. It's that bad that recently a professor in Harvard came out and said that he will not recommend supplement to any of his patients. Why? Because personally, he has not seen, according to him, he said he's not aware of any robust research or evidence that has been done that says that if you take a certain supplement, your hair will grow long, or your hair will be full, or your skin will shine, it will prevent wrinkles. There has absolutely been no research and no evidence whatsoever relating to that. Also, nutritional experts have gone further to do research and to actually find out, okay, is there something that can happen? They have also come out to say that, see, if there's nothing wrong with you, you are healthy, you're eating good, you're living a healthy lifestyle, you taking supplements, it's not going to add anything to your body. It's not going to make a difference. It's not going to make a change. There's no point, right? Don't forget that those vitamins that you're clamoring on trying to get, the body requires them in very little amount. So if you're actually having a balanced meal and a balanced diet, you're already getting those vitamins. And if you think that taking a supplement and adding to that is going to make a difference, it's not going to make any difference. Okay. Now, what are the possible risks? So, okay, you've heard all these things. You've ticked all the questions and everything is no. You've asked yourself all the questions and everything is no. But still,
you are going ahead.
You still want to go ahead. Okay, no problem. Go ahead. What's going to happen? Now, first things first, we've established the fact that it is not a drug. So tests were not carried out. It does not work. It's not safe. Why would you still want to try something like that and put it in your body? Now, you're going to have serious, strong side effects. It's not the regular, you know how when we women, we want to get skincare products and we're doing try and error, even if they say it works, we will still buy it. Our skin will still reject it. You can rub something in your skin, and the next day you see you have breakouts and things like that, minor side effects. It's the same thing for some of the supplements, because the ingredients that they've put inside are biological ingredients that are quite very strong. So your body will react. It's possible that you can have a strong side effect from that. Secondly, negative interactions with certain medications. So if you're already on certain medications, probably antidepressants or diabetic medications and things like that, and then excuse me, you still want to go and take supplement, there can be an interaction, and that will cause another problem in your body. So for example, this usually occurs with herbal supplements. It's more popular with herbal supplements. Let's assume you're taking aspirin or kind of like a painkiller with a supplement like vitamin E. Now, vitamin E on its own, it has the ability to reduce the effect of blood thinners. You now merge that with a painkiller. That will just lead to serious bleeding, or it can even lead to stroke in the long run. Because that's another thing. When people take supplements, they don't think of how long should I be taking this. They just add it to their lifestyle, and you can be taking that for a very long time. So that can lead to bleeding, and it can also cause stroke. Also, when you take certain types of supplements with maybe birth pills or contraceptives and things like this, or just like I said, maybe like antidepressant medications, it can cause certain reactions. So depending on the supplement, depending on the medication, that will determine the rate of the effects that you're going to have. Sort of. Now, swapping medications for supplement, we already know they are not the same thing. So that is a no. That's very wrong. You should never try and do that. Then supplements tend to interfere with lab tests and surgery. So let's assume, for example, you're facing you have a surgery that's due or something like that, and in your bid to, oh, I want to be healthy for my surgery, you're eating good, you are also adding supplement to it. And unfortunately, because you do know that most times when you take certain supplements, for example, the multivitamins and things like that, they're a mix of different vitamins. Some of them might have vitamin K, and then you're taking that and you go into your surgery, they start work and they realize that your blood is not clotting. That can lead to loss of blood because you have literally overdosed on that particular supplement and it has interfered with your surgery. Some other types of supplements can interfere with like lab tests and things like that. For example, diabetic patients who have to do series of tests. Sometimes there's certain supplements that can interfere with that lab tests. Then we have health implications of taking too much supplements, either vitamins or minerals. So you know how with our African mothers, there's this notion that we always get that too much of everything is never good. And the same thing applies with this mineral. That is why to start with, even the regular daily recommendation requires you to have them in very small amounts. So what happens when you're living a healthy life, you're having your required minerals and vitamins, and then you still add a supplement on top? That's going to cause double wahala. In as much as these vitamins and minerals, when they are low, they cause problem. When they are high too, they also cause problem. For example, vitamin A. Vitamin A, when it's low, it can cause hair loss. When it's too much, it will still cause hair loss. Aside from causing hair loss, vitamin A also has a tendency to cause, it can cause liver damage. It can reduce the strength of your bones and things like that. Calcium and vitamin D have, if it's too much, it has the tendency to like affect your bones and things like that. Then basically things like that. So when you have it too much, it can actually affect you. Okay.
I have a question there before you continue, like having it too much and not too much. You've already established the fact that it is not, it doesn't add anything, hence there's no need. But I want to just find out, is there, because somebody kept in the chat earlier to say, if you have a lot, your body gets rid of the excess. Is there anything like that, or any type of this supplement that our body could be able to get rid of the excess so that we don't get a damage from it? Yeah.
Not that I know of. The only one that I can say that yes, if you have excess of that, your body will be able to get rid of the excess is biotin. So but then obviously it's a side effect, because with biotin, when your kidney is working to get rid of it, you're using the restroom often. You always want to use the restroom. So, and the others, just like I said, too much of it will give you that effect. Your body will not be able to get rid of it. Right? Okay.
Thank you. Yeah.
So now we've said all of this, and it has made it look like as if no, supplements is not don't go near it at all, don't come close to it. So are they beneficial? Yes, they are. They are beneficial, but they are only beneficial to those who genuinely need them. If you are healthy, if you have, like I went through the questions at the beginning that you should ask yourself, if you've gone through all of that and it's a no from beginning to the end, you do not need them. You are going to fall under the risk. But if you do genuinely need them and the doctor has said, yes, you do need them, they are beneficial. So it helps you to meet your daily nutrient requirements. It also improves and maintains general health and well-being. For example, pregnant women need a certain amount of folic acid. So even when you need them, it also has to be in a certain amount. So pregnant women need a certain amount of folic acid, and this helps to prevent birth defects in the baby. We all know that vitamin C and vitamin D is a type of supplement that is very good for our bones. Biotin is a supplement that's very good for your hair and things like that. Your healthy fats, it's your fat oils are a type of supplement that is really good for your hair too, and things like that. Protein supplements, it's also good for your hair, good for your skin, good for the making of collagen for your skin and things like that. So yes, if you find yourself deficient of any of this, yes, they are very beneficial for you. Okay, now who needs it? So who are the people that need it? This is another category you need to look at. If you do not fall under any of this, then there's nothing you should be doing with dietary supplements. So first, older adults. Majority of the patients I work with are older adults. And these are the people that we are aware that need it, because what happens is that as we grow older, as we age, the ability for your body to absorb nutrients increases. If when you were younger, your body absorbs nutrients at the speed of 1,000, you can get to a certain age that to start absorbing at the speed of 800. So with older adults, they tend to need more and require more. Also, lactose intolerance. This is because lactose intolerance patients cannot take dairy products. And obviously, we know that calcium is a rich source, comes from dairy products, and a bit of vitamin D too. So now, lactose intolerance patients do need dietary supplements to help them to add to their diet, to supplement their diet. Also, individuals who are on restricted diets and a very strict diet. So, for example, the vegetarians and vegans, people who take out animal products from their diets and things like that, they will definitely need a B12 supplement. This is because one of the major sources of B12, in fact, the only source of B12 is animal products. Now, pregnant women, just like I earlier said, pregnant women need a certain amount of folic acid in order for them to prevent birth defects. So pregnant women, women who are looking at conceiving and things like that. Then adults that are diagnosed with certain diseases such as Crohn's and celiac. Now, with Crohn's and celiac disease, this is a type of disease where the body cannot absorb nutrients. So at this point, the body is struggling to absorb nutrients. So individuals who are diagnosed with Crohn's and celiac disease require supplements. And individuals who have osteoporosis is a disease of the bone. They require calcium supplements and vitamin D supplements. Also, some autoimmune diseases such as maybe something related to thyroid will require, someone who's suffering from a thyroid disease will require a selenium supplement too. Then nutritional deficiency. This is where most individuals who are not old or things like that might fall under. So it might be that you're low on vitamin D, or the doctor has said you're low on a certain vitamin or biotin and things like that. Now with vitamin D, we're in the UK. Once again, winter is coming. Winter is coming. The sun has gone. We do know that one of the the major source of vitamin D is sunlight. We have entered that phase where we do not have sunlight anymore. Your body will obviously be low on vitamin D. Most people drop so low that they require that supplement. So you might require vitamin D supplement if you're deficient. Also, so individuals with high physical activity. Now, I've seen individuals go to the gym and say they have to use a protein supplement or things like that because they are using energy. And obviously, the more energy you use, the more nutrients and things like that. But then again, I keep telling, when I get people who come to meet me, gym people, and ask me that, I keep telling them, you can get those nutrients, that protein supplement you're eating. Why don't you just get it from the food? You can get it from the food. The only people that I will say that, okay, yes, probably, that's why I put the high physical activity, are athletes and sports people. Those are the people that we can consider and say, okay, probably. And then with those people, they still have to consult their nutritionists, their sports nutritionists who are in charge of such. Now, poor eating habits, I put a question mark there because I'm like, you come out and you say, some people will come out and tell you that they went to get supplements because they have poor eating habits, they are not eating well. What exactly do you mean by poor eating habits? The only poor eating habits that I will consider is probably someone who has an eating disorder or something like that. And I can say, okay, let's try and work your way out. Well, if it's just you on your own, then I don't think that eating habits is something that is serious. And then also, even with all of this, for the people that need it, there's still a guideline. There's a guideline that everybody must follow. Whether you need it or you don't need it, you must still follow the guidelines. So what are these guidelines? First, you need to speak to your doctor or your healthcare professional. Either you're speaking to your pharmacist or you're speaking to your nutritionist or your dietitian. You need to speak to somebody about the benefits and risk of wanting to have a supplement. Now, when you speak to them, what exactly do you want to hear? So first, you should be saying, what are the potential benefits? Okay, I want to have the supplement. How is it going to benefit me? In what way and in what way am I going to gain? Second, you should be thinking, does it have any safety risk? What are the risks I'm going to face? What are the side effects that I'm going to have to deal with and things like that? Also, you should be thinking of what is the dosage. With everything, there is a dose. With everything you're taking, there is a dose, so you do not overdose. So you should be asking, what is the dosage? In what amount and what quantity am I supposed to have that? And then lastly, you should be saying how, when, and how long do I have to take the supplement? Something I always tell my patients, because most times when you give them supplements and you say, oh, try this out for a month and I'll get back to you and you let me know how it goes. When I get back to them and I see that they're fine and I'm like, okay, can you stop taking the supplement? You hear people say, no, I don't want to stop taking it. It's very good. It's helping me. I'm getting all the vitamins and minerals. I don't want to stop taking it. You actually have to stop taking it. Supplements are not things that you can take for a long period of time. It's only there to improve, to supplement, to add on, to increase, to support you. It's not there to substitute anything. Now, secondly, having a healthy, balanced diet. This is very important. Whether there's something wrong with you, whether there's nothing wrong with you. Even when we're dealing with patients who have the celiac or the Crohn's disease, the first thing we do is we call it the food approach. First thing, food approach. We always push for food. I would have pushed for food for 2-3 months. When I realized that the patient, it's not working, offering food is not working, then we now introduce the supplement. So your food is always what comes first, no matter what. If you walk into the doctors now and they tell you, oh, your vitamin K levels are low, food first. Before you even think of the supplement, think of your food first. Oh, how do I have this? Okay, what are the foods that are high in vitamin K? How do I get that up? Always think of your food first. Now, with your food first. So another thing you also need to pay attention is that term natural. That's something that they used to deceive people a lot. You see supplements and they tell you it contains natural ingredients. Don't think because it's natural, it is safe or it is healthy. Don't. Also, I was going to ask this question, but I don't know. I can't see my time. I don't know how much left I've got. How much left I've got. I was going to say, what do you think? Do you think supplements should replace food? Would anybody say they believe that your supplement should replace your food?
You can put your answers in the chat box.
Yeah,
If
you
you
can
can.
put your answers in the chat box.
Okay, I can see no. I see no. One no's coming in.
Thank you. Thank you. Your supplement should never, ever replace food. Whenever you're having a supplement, either you're having it once a day or twice a day, always have it at the back of your mind that at some point in time, you will stop taking it and it can never replace your food. You still need to pay attention and focus on your food. Now, just before I go to the next one, I was going to say something with the healthy balanced diet. Another reason why, one of the most popular acclaimed reason why people will say they want to take a supplement is they tell you, I want to boost my immune system.
Yeah.
How is a supplement? How is that supplement going to boost your immune system? Now, also research has also provided evidence that getting more than you need. So if, for example, let's say vitamin E, you require about 600 micrograms of vitamin E daily or vitamin A daily, and then you now take a supplement. Don't forget that, like I said, these supplements are not governed by any law. So they don't even have a limit. A tablet of that vitamin A might not even be 600, it might be 1,000, but you don't know. You will now take that and add it to the already one that you've gotten from your food. That's too much. So there's no evidence that that is going to add anything to your body. The only way you can help boost your immune system is by eating a healthy diet and also having a healthy lifestyle. So your physical activity, you're sleeping on time, you reduce your stress and everything. Just have a healthy lifestyle. That's the only way your immune system can be okay. No supplement, nothing at all is going to help you boost your immune system. Now, another thing is beware of the hype. People come out and say, I've used this supplement, it's good. Can't you see my hair? Can't you see my skin is glowing because I've used this particular supplement? Beware of the hype. There is no concrete health advice that will come out without a research that has been done over time, not just a single study. For example, I'm coming out now and I'm giving evidence. The research is there, the evidences are there. It's been done over time. It's not a single study. It's not just one article that came out and said, oh no, it's multiple. It's multiple nutritionists and researchers. So do not believe the hype. Do not come and say, it worked for A, why should it not work for me? No. One of the researchers mentioned something and she said it has to do with what we call the placebo effect. People believe what they want to believe will work for them. So if you're taking something and you feel that this thing is going to make my skin shine, it will start making your skin shine because it's what you believe.
So
it's actually not doing anything. So that's what she called the placebo effect. So always beware of that. Don't let anybody deceive you. Don't let anybody say anything of that such to you. Right. Yes. So thank you. And I'm just going to leave this few things up there for you to think of. Do you think supplements, do you think, it's a good medicine, or do you think it's a waste of money? What would you say if someone were to ask you outside, do you think I'm wasting my money, or do you think I should actually get it? And then also, don't forget that it can also be a way to distract you from living a healthy lifestyle and from having a healthy, balanced diet. I'm going to leave with this catchy phrase of, I was trying to find out a catchy phrase, but I said I wanted the phrase to relate to something that had to do with supplements. And I came up with this, and it has to do with, if you are looking for a cure, do not go to a supplement aisle. If you walk into a drugstore, a medication store, and you think that you need to get medication, do not go to the supplement aisle. You don't belong there. Thank you very much.
Thank you very much, Sylvia. That was really, really, really insightful. And I think I was just thinking about those days that people have back in Ghana, when somebody has cold or anything, they take these vitamin C tablets and everybody's just sucking it.
And so, actually, you know that it's the same way when during COVID lockdown, when it was very rampant then and people came down with COVID, the first thing they tell you, get vitamin C, get zinc. And we're all victims of all of that. We're all victims of all of that. Get vitamin C. But no research has showed that vitamin C and zinc actually works for COVID. There is no absolutely, there's nothing like that. There's no evidence.
All right, thank you very much. So we'll now go into to pick some questions. So I'll start with a few. So I think, yes, that was really good and it touched on some. I think the most important thing I picked was the placebo effect. There are a lot of people that just say, look, I feel tired. And they said, look, it's because you don't have enough, take a supplement. And immediately start taking the supplement, like, okay, I'm now okay, I feel alive. So that placebo effect goes in.
Yeah.
But for those that you think they do require to have, or they should, let's say after talking to their doctor or health professional, they should have they can have supplement. What would you say when it comes to the brand of the supplement? For example, we're looking at vitamin D or maybe any multivitamin. There are some store brands that are quite cheaper, like 50p, while others are as high as £5 to almost £10. What would you say to that? Yeah, what would be your advice?
So I think first and foremost, when I recommend supplements, I always look at the patient's condition. I look at the individual's condition. What are the underlying effects? Okay, is it just that this person is low on vitamin D, or is it that the person is having bone issues, or is it that the person also has, like I said, the first line of approach is food. So even before recommending that supplement, I will say, oh, go to your food. Don't you think you should try and eat foods that are rich in vitamin D and eat this and eat some eggs and have a bit of dairy product? And then if the person says, oh, I don't like dairy, I can't have dairy products, it upsets my stomach. Okay, that's fine. So you want to have the supplement, no problem. But at that point, aside from getting the vitamin D, let's not forget that that person is not eating. The person is not getting a lot of meals. So if there's a possibility that the person might be also losing weight. So I put that also into consideration. Now, if there's any other health condition, like maybe diabetic, or the person has a particular kidney disease and things like that. For example, if it's diabetic, I will not be recommending a brand that I know their supplements are sweet and have sugar content, because why? That sugar can spike up the person's diabetics. Yeah, so there are kind of like a lot of things to consider when doing that sort of. But always, even with all of this, after considering everything, I will always try and go for the cheaper brand.
Okay.
Yeah, something that's more affordable. Because imagine telling someone that, oh, okay, go and get the £5 one. And most times, if we look at it from some of the supplements I've worked with, if we even look at it, the cheaper ones tend to be more effective. And some of the cheaper ones, if you're dealing with someone who's underweight and you're trying to boost their nutrients and things like that, some of the cheaper ones tend to have more calories than some of the expensive ones. So,
yeah. All right, thank you. The floor is now open for questions. So please, you can just unmute yourself and speak, or put your question in the chat and I can read it out to Sylvia, please. Okay, nothing in the chat. Okay, Hibbah's hand is up. Hibbah, please.
Sylvia, thank you so much for that very insightful presentation. Can you just remind us about the UK recommendation for vitamin D, if you can remember? Because as much as we're talking about the pros and cons, for what the recommendations we have in the UK, I think if we can just remind ourselves that that's what we have, that would be helpful.
Yeah, so I think for vitamin D, it's about 100 micrograms a day for vitamin D. For vitamin A, it's about 600 for women and 700 for men. And even at that, it's not every day. It's kind of like every other day, sort of. So with vitamin A, you shouldn't be having that as much every other day. So if you notice, they're all in minute amounts. So for C and I think E and K, and most of them also vary with the age difference. So but for adults, for vitamin D, it's about 100 micrograms.
I just put in the chat for people to pick it up. Yeah.
Okay.
All right.
It's 10
okay. Thank
Okay,
you.
10
Yeah, I've kept
micrograms.
it. Yeah,
10
I kept it on
micrograms.
there.
10 micrograms. Okay.
Yeah,
And
I
that's
kept
just
it on.
one small tablet, isn't it? When we
Very
go to
small,
the
yes.
yeah, it's just one small
Yeah.
tablet. And that's, I mean, I just wanted clarity on that. That we are recommended to take, right? For the vitamin D, those of us in the UK, Public Health England, the government wants us to take that, especially during the winter months.
During the winter,
so
yes.
okay. To the best of my knowledge, that's the only one for, that is recommended for adults.
For
the
adults,
vitamin
yes.
D, 10 micrograms, which is just one small tablet. But other than that, for adults who are non-pregnant, we don't have any recommendations to take any other supplement, except if you've seen your healthcare professional. Okay, thank you very much.
All right. Any more? You can put either unmute yourself or just put your question in the chat and I can read it out.
Can you please expatiate more on supplements for those people with is it celiac disease or whatever?
For people with celiac disease, with that you will have to speak to your health professional, actually, because like I said, with celiac disease, there are certain nutrients that your body can absorb. The body finds it difficult to absorb nutrients. So a couple of tests will be run and you'll have to speak to your GP. Then your GP will refer you to a dietitian who will, like I said, first things first, food first, before we decide to give you a supplement. So it's when the food is not working, then the supplement comes in. We will not just outrightly say, oh, you have celiac, you can't absorb nutrients, go and get the supplement or try the supplement. No. First thing we always tell you to do is, what's your diet like? What's your appetite like? What kind of meals are you having? What sort of meals are you eating? And then if that's not working, if you go back and do your test and it's still low and things like that, then we can put you on the supplement. So I would not be able to say, oh, this is a supplement, this is a supplement, this is a supplement. You would have to have a discussion with your GP and your healthcare professional. It's not specific to one. It's kind of like a tailored approach. It suits every individual. What works for A will not work for B.
All right. Thank you. Any more? Any more? Let me ask another. I think, well, or just to add a contribution. I think when sometimes you go to a supermarket and you see the aisle for supplements or the medicines out, and you see that those amount of supplements there and how people consume them, or the amount of consumers that come in and pick them up. It must be a very lucrative business going on. And just thinking about it, buying 10 pounds of that could have bought something that you would benefit other nutrients in addition to that.
Yes, it will. It's a very lucrative business, especially owing to the fact that there's actually no the drug law. They're not under the drug law, they're under the food law. So all they need to do is ensure they follow the process, and whatever ingredients they've put behind is what is inside the capsule. So they honestly can't be bothered. It's a very lucrative business, and people just go to the store and pick it up, and you think you need zinc, or you think your body's low on calcium, and probably you wake up one morning and you have maybe a bit of ache in your knee, and you think that I've not been having a lot of calcium, maybe I'm wrong. So you should get calcium supplement and things like that. So yeah.
And I think what the message from here is about the hype and what we hear from family and friends. Something is wrong there. They are telling you that, look, you feel tired every day because you lack iron. You feel tired every day because you need folic. Like, so
Yes,
it is that where and people give testimonies to them that, oh, I was using this and look at my skin, it's glowing.
it's
So
glowing.
how
Especially,
can
I
we
think,
stand to the pressure of this from the community?
yes,
Like
I
from our
think
family and friends.
I think especially it's quite rampant with a lot of hair supplements and supplements for hair and nails and things like that. You think that all your nails are breaking off too, and you should actually look at your diet. Or if you've looked at your diet and you think that it's still happening, then you should speak to your GP because it might be a sign or a symptom of something serious. It's not just something that you can go and get a hair and nail supplement for. Because just like we explained, there's no evidence that this actually works or it's even safe. There's absolutely no evidence.
All right. I just wanted to add something that somebody drew my attention to. You know, most of what we have done today is more about adults and all that. But if you look at the NHS website, they do also have some things specifically targeted for children.
For
And
children,
I'll
yeah.
just quickly read what for children what they have to say. So um, they say children supplements containing vitamin A, C, and D. Children aged 6 to 5 years should take vitamin supplement containing this every day, and asking you to read more on it. So I'll just put it on the chart. This is something that we have done at the past, looking at the healthy start and all that, so that we can next time we would have a more tailored one to look at for that for children. Yeah. So Sylvia, before you we run out of time, could you give us your closing remarks, your closing message, what we can take home and be that message of change, not to waste money and to really use the money well to eat healthily rather than I like the last picture that you had with all the supplements in the bin. We should rather look at our cupboards, pull them out, and put them in the bin and eat well. So
Yeah.
please, any last words? Can you wrap up for us, please?
Yes. Before you if you think you want to have supplement, the money you want to use to go and get that supplement when there's absolute the doctors have said there's nothing wrong with you, you're not deficiency or no disease, you're very healthy. I would advise that you use that money to go into the supermarket and get vegetables and fruits, a variety of vegetables and fruits, and add it to your balanced diet. And also, the only, just like what Dr. Hibbah said, the only supplement that is recommended for you to take is the vitamin D. Even with the vitamin D, you're not taking it all year round. It's just during the winter period because the sun is low. So yeah, and then before you think of, even when you do speak to your healthcare professionals, always ask, what's the potential benefits for me? What's the risk? You're asking me to go and get this supplement. What's the benefit? What would come out of it? What's the risk? And for how long do I have to take it?
All right. So thank you very much. And I've left a few these things in the chat. Feel free after this, you can put your questions maybe on our YouTube channel or Facebook, and we could get Sylvia to provide us with some answers. So Sylvia, thank you very much. This was really insightful, especially where we are getting to now with the cost of living and all that. We want to really economically use our shopping money well and not end up buying things that we do not need, things that would rather cause us more harm than good. So thank you very, very much for today's session. So on this note, I think I would hand over to Daniel. I don't know if Orlando is in. If not, I think we finished a minute before. Wow, today we have done well. Thank you, Sylvia. That's good. I thought we would run out of time. So if Orlando is not there, oh, Orlando is there. All right. So Orlando, over to you. Thank you very much, and we are
Thank
handing the
you.
baton to you. Thank you, Sylvia.
Thank you. Thank you, everyone, for joining. Thank you.
You're on mute, Orlando.
Thank you, Wise. Hello and a warm welcome to the exercise part of today's program. I hope everybody enjoyed that seminar back home, whether you're watching across YouTube, Facebook, or Zoom. So today we have week 4 of our boxer-size workout. Again, we're going to learn some new combos, get fit, but have fun at the same time. For today's session, all you'll need is plenty of space, plenty of water, and a mat. We've got a round on the floor today. So a mat or a cushion or whatever you might have at home. Okay, 7:30, let's get straight into it. Let me turn my tunes up. Right. So we're going to start our warm-up by going into a shadow skip, okay? If you have actual skipping ropes at home and you have the skates, feel free to use those. If not, we're going to shadow skip. All right, get ready. 3, 2, 1, let's go. Are you really rotating those wrists? 1. 5 seconds. 2, 1. Okay, next we're going to throw our straight. Okay, so that's your jab and your cross. Let's go. Keep it nice and light. Three, 2, 1. Next we got squat reach. So squat down, touch the floor, and touch the ceiling. Let's go. Five seconds. 2, 1. That's time. Beat 4. All right, give yourself 15 seconds. Take on some water and join me back to continue the warm up. Okay, people, back to your spaces. Let's continue with this warm-up. Okay, so next drill, we've got a footwork drill. So what we're going to do in your guard, we're going to take 2 steps forward, pushing from the back leg, like so. Keep your guard up. Then we'll take 2 steps backwards, pushing from the front leg, like so. Okay, so stay nice and light on the ball of your feet. 1, 2, 1, 2. Okay, let's go for 30 seconds. 3, 2, 1. Let's go. Keep that going, people. 3, 2, 1. Back to your shadow skip. If you're able, let's go into 1 leg. If not, stay on 2. Cage legs. Back to 2. 3, 2, 1. Back to your strict. Ten seconds. 3, 2, 1. Rest there, my people. Give yourself a 30-second rest. Take on some water. Take your arms around the water. Well done, people. "15 seconds, people. It's game time." Okay, people, join me back in your spaces. Let's get into round number 1. All right. So if you are new to the call, when we do box exercise, we box for the full 3 minutes, okay? So full 3-minute boxing round. So first round coming your way is a combination round, okay? A combination round. All right, so for the first 60 seconds, in our guard, I want 4 straights, nice and hard. So it's going to be a jab, cross, jab, cross. If you've been on these calls for a while now, remember we're boxing from the ground up. So really try and put your full body into these punches, okay? It's not just coming from the shoulder like so. It's really a full body movement. So watch my hips, watch my legs. I'm going forward, rotating the hips, forward again, rotate the hips. All right, try and get as much power and strength into your punches as possible. Right, people, let's start the round. Let's go, 60 seconds. All right, people, let's get ready now. Let's get into the round. We're going to go in 3, 2, 1, go. Keep that going, people. Throw it nice and hard. Keep going, people. 30 seconds down. Keep going, people. Ten seconds. Okay, stop the clock right there. All right, so let's add to it now. After that last cross, I want 10 uppercuts for speed. Okay, so I want a nice strong 4, 3, 4, and then 10 uppercuts, nice and quick. Really rolling them shoulders. Let's go, people. 3, 2, 1. Put that together now. That's right, people. Halfway, 30 seconds to go. 15 seconds. Two, one. Okay, pause right there, people. 2 minutes down, 1 to go. All right, last edition now. Let's put it all together now. So start 4, 2, 3, 4. Nice and hard. Then we've got 10 here. Then we've got 10 straights here. Nice and quick. So 4, 10, 10. And then start from the beginning. Let's go, people. Last minute. 3, 2, 1. Let's go. We're going, people. Almost there now. 40 seconds to go. 20 seconds to go. Keep going, my people. Let's work. 10 seconds. 3, 2, 1. That's time, my people. Well done. Round 1 down. Back to your corners now. Take it some water. Rest for 30 seconds. And we're back to round number 2. Okay. 10 seconds, my people. All right, people, join me back in the ring now. Round number 2, game time. All right, round number 2, we have a combination round, pyramid, legs. We got it all in this round, all right? So boxing combination will stay the same and the exercise will stay the same, just the numbers will change. All right, so first things first, we're here in our guard. We've got a jab, cross, uppercut, cross. Okay, 1 time. From there, we've got 2 squats. So we're gonna go half squats. We're gonna go here, explode up, there, explode up. Second time around, we've got 2 combos. So watch again. Jab, cross, uppercut, cross, that's 1. Jab, cross, uppercut, cross, that's 2. From there, we've got 4 squats. All right, so nice and explosive. Hit 4, nice and strong. And then lastly, we're going to hit the combo 3 times. So here, that's 1, 2, 3, and then we've got 6 squats after that. Okay, so once you've hit 3 combos and 6 squats, you start back at 1 and 2. Okay, let's hit it hard for 3 minutes, people. Come on now. Let's go. Start with 1 combo, 2 squats. Let's go on the drop. Get ready now, people. Ready, guards? Get ready, people. 3, 2, 1. Now 2 combos. 4 squats. Combos. with 6 squats. Once you've got 3 and 6, right back to 1 and 2. Keep working, people. 50 seconds gone. Let's go, people. Work through it now. Work through it. Jab, cross, uppercut, cross, squat. Halfway now, people. Keep going through it. Let's go. Last minute, come on. Forty seconds left, people. Keep working that combo. Keep working the squats. Let's go. Almost there now. Twenty seconds. Last 10 people. Keep going. Keep going. 3, 2, 1. That's time, people. Well done. Back to your corners now. Take on some water. Enjoy it for our third final round. Well done. 15 seconds, people. Okay, people, bring your mats in now. All your cushions for our third and final round. Okay, people, let's go back in the ring for our third and final round. All right, now we've got a combination round mixed with abs. Okay, trying to get those solid abs. All right, so again, combo will stay the same, but the exercise will change. All right, so we're going to break this down into 6 30-second segments. All right, again, combo will stay the same. Watch, in your guard. Double jab, cross, hook, hook. Once again, double jab, cross, left hook, right hook. We're going to go there, 30 seconds. Once we've done that, we have a forearm plank on the floor. Okay, forearm plank on the floor, nice and straight, bone down, core engaged, strong arms and shoulders. All right, people, so 30 seconds. We're here, double jab, cross, hook, hook. 2 or 3 in the same place, keep the whole floor, move around, jab, bang, hook, hook. And then from there, we're going to hit the floor for forearm plank. Let's go, people. Last round now. Come on. Get ready. Let's start with the combo. Get ready now. You got 3, 2, 1, go. Let's go. Let's go, people. 10 seconds. 3, 2, 1. Let's go. Down to your plank. Stay nice and strong. Stay nice and flat. Take your mind elsewhere. Focus. 10 seconds. Oh, back up. Straight back into your combo. Let's go. Back on, people. 10 seconds. 2, 1. Okay, we got standing crunches. So one side, 15 seconds. Let's go. Inside. Keep that going, people. 3, 2, 1. Last minute now. Back to your combo. Let's go. Ten seconds. 3, 2, 1. Full sit up now. Let's go. Let's go, people. 10 seconds. 3, 2, 1. At time, people. Well done, well done. We'll take 30 seconds, get some water in you, and we'll cool down and stretch up. Well done. Okay, people, join me back in your spaces. Let's stretch up now. Start by moving our next side to side like so. Nice and slow. Okay, up and down now. Okay, arm rotation forward. Backwards. Change arms. Up backwards. Okay, rotate those hips down, big circles. Get all those little flips out. Change direction. Front to back. Last one. Feet together. Slight bend in the knees. Try and touch your toe or the floor. Ten seconds. Come up nice and slow. Take it all off. Make sure everything still works. And that's time, people. Well done, well done. Definitely give yourself a pat on the back for that. We have Sam or Praise on the call and in the house today. Praise or Sam, is anyone on?
Yes, Orlando. How are you, sir?
That's Sam?
Great session today.
Yes, Sam. Well done.
Good call of the day, guys. Thanks for joining us on this topic. Take your supplements and do your research. Bye-bye.